Does deceleration training assist in minimizing non-contact ACL tears? Before we answer that question, we should probably look at the 3 ways you can tear your ACL. The first one is direct contact. Direct contact would be if somebody kicked your knee or if somebody fell on your knee and it hyperextended to tear your ACL. The second one would be indirect. An indirect way of tearing your ACL is, if you can imagine running down the court and somebody bumps your hip and you plant your foot to stabilize or maintain your position and you have a little bit of a knee shift. That is the indirect way of tearing your ACL. And the third way is non-contact. We're gonna focus our topic or focus our info session on non-contact ACLs, as they comprise of approximately 70% of all ACL injuries. Now, before we outline a plan or a strategy for minimizing the risk of ACL tears, we need to have a good understanding of the ACL loading mechanism. So the ACL functions to resist tibial anterior translation relative to the femur. So what that means is when you stop and you plant your foot, if you didn't have that ACL, your shin bone will just slide forward or continue to slide forward. So that ACL prevents that from happening. The magnitude of the shearing force is affected by the posterior ground reaction force and knee flexion angle during the movement. So the harder I plant, the more force it goes forward. So this is where a balanced quad and hamstring co-contraction strength ratio comes into effect. The hamstrings assist in pulling the tibia posteriorly or backward to reduce the strain on the ACL, and the quads during a closed kinetic chain activity act as a brake. So they just clamp down to help assist in that, preventing that anterior translation. Now, we all know that a sudden change of direction or deceleration, landing, or aggressive pivoting can cause an ACL tear. But if we look closely at the following non-contact ACL injuries, there's an important piece of the puzzle that isn't outwardly addressed. As you can see, majority of these injuries occur when the athlete's leg is outside of center mass. So what does that mean? Well, preventative strategies, we think about deceleration training exercises. But when we do see those, we see controlled landings from a box or a simple jump. Or we think of immediate stop drills from sprinting. But how effective are those for minimizing non-contact ACLs? Deceleration training as a whole can be good, but having an understanding of progressing these exercises will be key in minimizing non-contact ACL injuries. If we look at your traditional eccentric exercises or deceleration exercises coming from a jump or landing from a box, we can see that the joints are stacked. And you can see right here that each point lines in alignment. Same goes for immediate stop or deceleration training from a sprint. You can see that center mass lines over each joint. When we are looking at what happens on the basketball court or in sport in general, we know that that won't happen all the time. And the moment that doesn't happen, where your center mass is not over top of your joints, that's when we are at a high risk of tearing that ACL. So what do we need to do to effectively train to minimize the risk of non-contact ACLs? Well, for starters, I mean, the global approach is a no-brainer. We need to have a strong core. We need to have core proprioception, and we need to have lower body strength. But specifically, we need to have neuromuscular control. And when we do neuromuscular control training, we should be exposing the body to movement patterns that mimic the vulnerable position that we might face on the basketball court, albeit in a controlled setting. Let's have a look at proper deceleration training to minimize non-contact ACL injuries. So the number one thing is you need to learn how to transfer your weight in all directions. So front, back, side to side, multi-directional. Start narrow and then extend your base out. Progressing from this, number two, increase the intensity by doing it more explosively or even adding a load. So holding a medicine ball, if you will. Number three, now we start to overload the drill with a band or even jumping from a height or falling from a height rather. So as we can see here with this particular drill, we see that center mass is not over top of the leg. And then finally we piece it all together. We have to practice proper change of direction. Various drills with the ball or without the ball, with a partner, without a partner. The idea, though, is to have that reactionary component. So two things: work out of center mass and have that reactionary component. So in that way, your body can understand and know when to fire, how to fire, to be able to change directions without giving way.